Definitely, there is very, very little reason to meet an orthopedics or an orthopedic surgeon, provided you follow, as we were telling you, the natural way of living.
Hello, everyone. Welcome to yet another episode of Doctor Story. Orthopedics. Orthopedics is a medical specialty focusing on the diagnosis, correction, prevention, and treatment of patients with disorders related to the musculoskeletal system. Now, your musculoskeletal system supports you and helps you move. It's made up of your bones, joints, also include your muscles, tendons, and ligaments. We may injure them sometimes, isn't it? We may get a strain, a sprain, or a problem from overuse. So, to help us relieve such pain or at least guide us how to, we have invited Dr. Manivannan, MBBS and MS Orthopedic, Chief Consultant and Founder Chairman of Mani Sundaram Medical Mission. He holds 15 years of extensive experience in all sorts of orthopedic surgeries. A very good afternoon, doctor, and welcome to Doctor Story.
Thank you.
So, doctor, you
Hi.
have so many years of experience. What would be the most common orthopedic issue patients come up with?
People usually come up with a low back ache. That is beyond, it cuts across all age groups, and it involves all socioeconomic groups as well, because it involves your daily activities, and that's how most of the patients from younger age group, you can say like more than 18 years up to 60 years, 70 years, people come up with the complaints of low back ache as the most common one in orthopedics.
Is it also because of like the post-pandemic culture that we have, sitting most of the times, being at home, that too, accounts or aggravates the problem?
Definitely. In fact, like low back ache do persist earlier also, but this pandemic has resulted in a lot of work from home. Population has increased, and as well as the workload on the homemakers has also been increased. All this put a pressure on the spine, which in turn over a period of time resulted in low back ache, and the prevalence is slowly coming up.
Right. So, largely, if we speak about low back pain, how can one avoid lower back pain? In 4 to 5 points, if you could sum up for us.
Before going into the solution, let us try to understand how a spine works. So,
Right.
Spine actually maintain both the upper limbs as well as the lower limbs, and it is the main mission which keeps the engine rolling up. And this spine has got three curvatures: one at the neck, one at the mid back, and another is the lower back. And the most interesting part is that the neck as well as the lower back are the most mobile portions of the whole spine. And that's why you always get either a neck pain or a low back pain, because the maximum stress occurs at the flexible, at the meeting point of flexible as well as the fixed portions. In the neck, it meets at the point of the neck as well as the mid back, and the lower back and the mid back portion lower down, we have got low backache. So that's how it is.
Right.
And this spine is not a straight line, but it has got curvatures. And this curvature, when maintained throughout our 24 hours, the chances of low backache is near zero. But what happens is, like you are sitting like that and I'm sitting like this, but if we are going to continue this conversation for more than half an hour, I'm going to crouch back, front, and I may lean back. And these two postures are not the erect postures, and which is going to cause a strain on the structures in and around the spine. It is not only about the bone of the spine which is made of, but as well the ligaments, the muscles, which are all forming the supporting structures of the spine. So what happens is, if we are conscious about how we maintain our spinal curvature, most of the problems get solved. For a simple one, we can start from going to bed for 24 hours and again back to bed. So if we take this 24 hours, when you go to bed, you have to see to that the curvature is maintained on the lying down posture, which by means your bed should be firm. It should not be too soft as if to cause a boat-like structure, or it should not be too hard. And as well as if you have a proper supporting structure to the neck muscles will be relaxed throughout your sleep. And when you get up, when you do small, even 10 minutes or 5 minutes stretching exercises, which is going to stretch your ligaments around the spine, it is going to give a refreshing, infusing energy to the spine. Number 3 is that when you travel, you imagine you get up, you get ready, and you're getting into a bike or a car or a bus, whatever it is. Make sure that you adjust your spine once in half an hour. If your journey is going to be beyond half an hour, and make sure that you imagine that you are relaxing the muscles. See, I always believe the coordination between the mind, body, breathing, which forms the yoga or yogasanas, has got much to do with the orthopedics. So once you understand this concept, slowly this conscious effort will become a subconscious habit, and your spine will feel very comfortable. And while at work, make sure your chair has got a back support at the lower end, which is going to support your lower back, which will give a cushion-like feel, and you will be able to continuously work without any discomfort. At this juncture, I would like to remind you that, like, when you start working, particularly the IT professionals, or who are all professionals who are on call through work from home or through Zoom meetings or whatever it is, once they get into the work, they totally forget their discomfort which is causing into their spine, which ultimately results in a kind of a stiffness towards the end of the day. And while coming back from work, you just take a shower and do small set of stretching exercises, which will definitely energize your spinal muscles, and then try to take food at an earlier period and go to bed early. So this routine, which I say, your conscious effort in the initial period, your stretching exercises, your efforts to maintain your posture during your work, which we call the ergonomics. The ergonomic postures or the ergonomic advice given by the doctors, if you can follow correctly. See, any habit, I believe, like more than 21 days, as told by elders, will become a habit. So these things, when you follow, definitely this lower back problems, the prevalence will come down.
Okay, one sitting, standing, any posture that affects the lower back pain the most, the worst of any posture, that is a big no-no.
Sitting.
So sitting for how long, as you said?
More than half an hour.
More than half an hour, exactly. Okay. There's this.
I'll tell you something.
Yes.
I'll tell you something. There is a very small test to make you understand how a ligament works. See, this is a very small toy or an elephant, which will be few grams. See, if I ask you to hold this like this for few minutes, or I say like as long as you, how many minutes can you hold it?
So
you may say 5 minutes, 10 minutes. No. Beyond 2 minutes, you will start finding a strain over the elbow here. It is not about the bone, it is not about the muscles, it is about the ligaments, which is being kept in the same posture for a few minutes. It's causing kind of discomfort. So this discomfort becoming more and more common with the sitting posture. And sitting is the most comfortable one, but again, beyond half an hour, your body will ask you, will warn you, give you a signal, so kindly give me a stretch. So that is how it works.
Right. So there's this common belief about the weather relativity. Does weather also makes joint ache? Or if yes, how does it affect?
It's a relative term. Winter seasons, cold weathers definitely causes some kind of muscle soreness. So I would say, like, see, how can we relate more scientifically is that any kind of increase in temperature will improve the circulation. Improving the circulation will give more of an energy to the muscles or to the joints. So in cold weathers, the blood vessels will constrict. So that, see, it is all the nature's way of responding to the winter, to the cold weather, in order to preserve the warmth. So in those situations, the muscles will go for a soreness, and and as well as the joints will become a little stiff. So you may find it yourself, like even in healthy individuals, during nights, though you will be having a blanket, if the weather is too low, it's too cold, the next morning you will find it really difficult to move your joints in the initial few minutes. Then you stretch, make your muscles work, and the warmth comes up, you'll become better. So weather has got a relation to the joint pains.
Absolutely. So doctor, if we talk about arthritis, is there any way to get relief from arthritis pain naturally?
See, I would say like it's more of a prevention rather than curing the disease. See, when you want to understand the treatment of arthritis, you need to understand what is arthritis and how it gets. See, arthritis means the joint is getting inflamed. So what is a joint? A joint is a meeting place of two bones wherein the end of the bone becomes smoothened and it has got a cushion-like surface. That cushion-like surface is called the cartilage. This cartilage, very similar to the suspension that works in a car, over a period of time, it gets slowly gets degenerated. That's why we call it arthritis. So this arthritis has got different reasons why it happens. One is the most common is the aging. So as age goes on, because of the load which is being continuously applied over the knee joint, we take knee joint as a commonest one because that's where the load commonly goes through. It slowly gets withered off at the most common points of heavy load stress, and it slowly gets degenerated and it becomes more rough in surface. And whenever the joint moves, as in climbing stairs, walking, standing from the sitting posture, the joint will have some sensations, sensory nerves which goes to the brain, and it causes the pain sensation. And this pain in turn causes the muscles to contract. That's why you get stiffness also. Rheumatoid arthritis is an autoimmune disorder wherein the body reacts in such a way that the immune system of our body treat our own joints as a foreign body and then develop antibodies against it and causes an arthritis. So likewise, there are numerous other causes which can cause the same arthritis but in different forms. So arthritis is basically damage to the joint cushion surface called the cartilage, which results in less mobility, pain, patient becomes more discomfort, and they may find it very difficult to carry out even their daily activities as the disease progresses. So this is how an arthritis occurs. And you are talking about, is there a natural way by which we can prevent arthritis or we can handle arthritis? So that's why I started with how it works. So now you would have understood, like graying of hair, like wrinkling of the skin, arthritis is a natural process. But still, with diligent effort, when you understand that what are the reasons which can cause early degeneration, early arthritis, we can always prevent it or postpone it as late as possible. Which I mean, increasing weight. Weight gain is one of the major causes of early arthritis. It is very unfortunate to see patients nowadays who come up at the age of 40, 35, they've got early arthritis. So what could be the reasons? See, I can take the cue from your own word, natural way. Are we living a natural way of life? Definitely not, because of the fast life around us. When I mean fast, it does not mean the time alone. It is about the air we breathe. Air we breathe, the amount of sleep we have. When we say sleep, if I can ask you, like what time do you switch off your mobile phone and prevent your eyes from seeing such a bright light in a dark atmosphere? You may say it's 11 o'clock. Some says it's 12 o'clock. So that particular time, the melatonin secretion comes down. It is supposed to be the most important thing which regulates our body, regenerates our brain. But what happens is, this kind of lifestyle, when I am just taking this mobile phone usage or a laptop usage at the late wee hours of the night, But still, there are a lot of the things which usually disturbs the natural way of living, and hence the natural way of postponing this arthritis by living an arthritis-free life is becoming very, very impossible. But still, when you understand these things within our areas of concern, we always call it circle of concern and circle of influence, we can always have a control of our own lifestyle where all it is possible, and we can always do that. So what are the methods by which you can, in the sense like you can make your joints healthy, that way I can put it. You can always do stretching exercises, which I mean stretch your muscles, which is going to increase the circulation around the joint, which will lubricate the joint. And as well, when you keep strengthening your muscles around the knee joint, it will keep the joint much more stable. How? It is how the pillars act. The pillars, when you see a building, you've got beams and pillars, which are the strength of the building. Very similarly, these muscles and ligaments, when it gets strengthened, it will reduce the load which is being directly passed on to the joint. You will feel light. You can understand, like whenever I say, like beyond 18 years, your height in centimeters minus your weight is your ideal weight. For example, if you are 170 centimeters, 70 kg is your ideal weight. If you are going to be 78 kg, you are carrying 8 kgs with you throughout the day. I mean throughout the day. So that is how it works. When you are conscious about it, automatically you will take steps to reduce it. So you need to understand like where you really stand. At 45, you should know like how much you can walk, how much you are supposed to walk, what should be your capacity to walk. So how should I go about it? If I am not able to do that, what are the things which is preventing me to do that? Is that because of the weight? Then I need to go on dieting. So very similar way, when you understand, it is very similar to max. 2 plus 2 is 4. When you have excess weight, you are going to get arthritis. So there is no shortcut methods to prevent arthritis or to cure arthritis. It is about going the straight way. You can't take an elevator. You are supposed to take the steps. I think that answers my question.
Exactly. Okay. So, doctor, there are so many people, and most of us actually tend to avoid to see an orthopedic. We tend to try different stuff at home, and lack the process more. It becomes, does it actually, worsen the case overall, and how instant or how quick one should be to see the orthopedic?
Yeah. To answer that question, like I would take up a small example. See, when you go to a restaurant, you take a sumptuous meal, be it vegetarian or not vegetarian. You get to taste beautiful food, tasty foods, and at the end you have a good dessert, be it a cake or an ice cream. But you do want to do the same thing at home, following the recipe in YouTube. Does it come out the same way as you think? It never. So very similarly. The thing is, see, definitely there is very, very little reason to meet an orthopedics or an orthopedic surgeon, provided you follow, as we were telling you, the natural way of living. See, what is natural way of living the other way around is that like you should have an adequate amount of sleep, which regenerates your body. So be conscious about your diet and do the exercises which are appropriate for your age. That can be advised only by a good physical trainer, personal trainer. And then, are you really reducing your stress every day? Are you planning your day in such a way that you are, stress is inevitable, but you can always reduce that. So when you reduce the stress hormones, which are mostly the steroid hormones, when its levels get reduced, your mind gets calmed down, your muscles, ligaments, joints will be energized. So all these put together, you will have a better contribution from your side in maintaining a good health in turn, which will maintain a good joint or the muscles or the ligaments well-being. In this context, whenever you start having problem, the main issue comes when people think it will go off.
Hmm.
It is a simple backache. It is a simple muscle sprain. I know that. It is. I used to get it often. Whenever I used to work, I used to get it often. But at what age? It is the age of. It may be the age of 12. It is maybe the age of 18, where the recovery is the rule. Again, see, you should understand whenever a pain which doesn't get subsided by itself beyond 12 hours needs attention. When I say attention, first the attention of the self. You should understand like what is the amount of or the intensity of the strain or the injury which has caused this pain. And the second is that whenever there is a swelling, whenever there is a redness, whenever there is an increase in intensity of the pain over a period of time as hours goes on, then it is very appropriate that you consult an orthopedic surgeon in order to find out whether it is a simple injury which is going to get all right in 3 days of time, or does it need any interventions in any form. So to put it short, I would say the best judge will be your instinct. Follow your instinct. Most of the time your instinct is correct, that it will say that take me to a doctor. So you need to follow your body, and what it asks, kindly respect that.
Well, a fantastic piece of lifestyle changes suggestions here. I think, yes, we should get note of it, everyone. Okay, so lastly, doctor, if you could help us differentiate between a muscle pain and a joint pain. How do a common person differentiate on his own? Is it a muscle pain or a joint pain?
It's very simple. See, the muscle pain is that it starts with a soreness, which means like first thing is that the patient will feel, or individual will feel difficult in moving around. Whenever he keeps moving, the pain is definitely felt over the muscle. A joint pain is very typical during the starting of the motion, starting of the movements, like standing up from the sitting posture. Standing for a long time, the pain is very typical over the joint. And more so ever, if you really want to confirm it. See, when I say we will take this finger, and this finger has got two bones, 1, 2, and 3, which is like this, which moves around like this. Yeah, muscle pain will be felt over the bulk of this pulp, whereas a joint pain will be felt at this two ends on either side at the junction of this joint. You have a very typical pain here. We call this in our term joint line tenderness.
Okay.
So getting up from the sitting posture and lying down for a long time and then getting up, you get a pain that is typical of the joint pain. Whereas for a muscle pain, it is definitely felt, and you will not be able to move beyond certain distance.
Well, I think you illustrated so well, it became so easy to understand. We couldn't thank you enough for taking out time for this discussion, Doctor. I firmly believe our viewers will greatly benefit from our discussion today.
Thank you. Thank you so much for the opportunity given.
Have a great rest of the day.
Thank you.
Thank you so much.